I'm Don McCown. I am a professor of public health, and I'm the director of the Center for Contemplative Studies at Westchester University of Pennsylvania. So, in my role as the director of the Center for Contemplative Studies, what I've been concerned with for the last 12 years has been mindfulness and the various roles that it can play in education, in clinical work, and in community building. So the community building part has become really important to me. And so as I learned about shared reading and the reader organization, I saw that what was happening in those shared reading groups was the same kind of thing that was happening relationally in a group that's learning mindfulness together. So this is kind of the starting point for how I think about the arts. Now, at the Center for Contemplative Studies, we do shared reading, and we do it in the community, and we do it in other areas, which I'll talk about. Well, since I'm in kind of a strange limbo in between those two things. The Center for Contemplative Studies is not an arts program, and it's not a social care provider. It is, however, part of the Department of Public Health at Westchester. And so I'm very concerned from that level of things. And one of the things that I think has been most moving for me over the last 5 years, 6 years, has been bringing shared reading into our local Veterans Administration Medical Center, particularly to the domiciliary. So we bring homeless veterans in and work to get them back into balance mentally and physically, and then help them achieve employment. And finally, they're able to leave that domiciliary. It seems to me that if both groups are committed to that, both the wellness side, which, as coming from a public health background and coming out of the public health department, that's what we're interested in. So that's what myself and my colleagues are really trained in community public health. So we are doing it on a small scale. One of my graduate students, a master's student in public health, took my certificate in applied mindfulness and took my training in becoming a reader leader in shared reading, and has moved after graduation into a program director position at the Center for Positive Aging in the township of Lower Merion. And so it's Positive Aging Lower Merion, the Palm Center. And her work started out online, on Zoom during the pandemic as a shared reading group. Really, we talked about it mostly in terms of overcoming loneliness, and we did build up a really nice group of 11 people who were sharing stories and poems. And that group was then able to go live with masks, and still is in masks, but is now live at the center itself. So, as well as including art, and particularly art making, painting courses in our minor in contemplative studies that we offer. So our students are being prepared, particularly in public health, both at the bachelor's level and at the master's level, to go out and be thinking about putting together public health, particularly public mental health, and the arts. I think that that's what we can do. I really want to suggest, though, that arts groups take a look at what's going on in their local universities, and maybe not looking at the obvious places. Maybe, maybe it wouldn't come up that you would look at a Center for Contemplative Studies, of which there are a number in the US now. And I know there are a lot of mindfulness programs at the master's level in the UK. And how do we take what we know and what we understand about arts practice and mindfulness practice and open it up to be used to create safe spaces and safe places for expression in our communities? I think for me, that's like the most important thing that could come out of this, is that those collaborations could build community, and could build community in which it's safe to talk about all the other things that we seem to need to talk about right now.